And so this is our Founders Day celebration, and we've done this a few years in a row to have the honor students present, and it's been excellent.
Good evening. My name is Jacqueline Boone, and I would like to introduce you all to our project with the Young Breast Cancer Survivorship Network.
So to kick off Breast Cancer Awareness Month, we provided education to the students, faculty, and just everybody who walked in at the LRC on October the 1st.
But in the month of October, 50% of their proceeds from the sales of the Power of Pink bracelets and all the merchandise were donated to the YBCSN.
We've also been able to participate with the YBCSN in their Lunch and Learn. Along with Dr. Newsom Kemp, who was my mentor, we did telemedicine to improve depression adherence to HIV-positive women in the Rural South.
And we partnered with Dr. Karen Meneses and Sylvia Kamada and the Young Breast Cancer Survivor Network as well.
Breast cancer survivors, they're not as open with their spouses and family members about their needs because they don't want to seem like a burden or things like that.
So we decided to educate husbands on the emotional impact of mastectomies and just in general chemotherapy, the after effects.
What I did was they have an Earn While You Learn program, which is for mothers and fathers and friends to come in. And they take classes, and what it is they watch a video, and then they talk with the mentor. But there was no way to gauge if what they were doing was effective, and so I created a survey.
Basically, a problem is identified, such as low mobility, and then a team is formed, some planning happens, change, and then try to work to sustain it. We came in at the change phase. That by day 2 of admission, or by the next day of surgery, a patient who did not have any contraindications would ambulate at least 100 feet and ideally 300.
We found that not only did they meet their goals, they exceeded their goals. Most patients were walking 1,600 feet when they set a goal of 100.
And now in Myanmar, the neonatal outcomes are worse than in many developing countries. And there's a strong correlation between health literacy, low education, and unemployment. So all of these things really tie together to make a perfect storm for women and their prenatal outcomes.
Our goal at this point is just to describe women's knowledge of pregnancy and prenatal care. Out of our participants, the years ranged from 17 to 40 years old. 60% of our participants were at risk for limited health literacy, even though 2/3 of them graduated from high school. From our survey, we definitely know we need to consider health literacy because this population might be at risk for limited health literacy, and we need to focus on that and make sure that our educational intervention is culturally appropriate. And then we will be going to San Antonio, Texas, the first week in December and presenting at the National Rural Health Association.
So I'm going to do just a very quick slide presentation about the founding of our chapter. We are the only nursing honor society in the world. We are the 12th chapter in the entire world. Our first president was Margaret Millsap. The future of nursing is with you.